Good afternoon to one and all. Seeking the blessings from His Holiness Sri Jagadguru Shivaratri Deshikendra Mahaswami Ji. Myself, Dr. Chaitra S., Assistant Professor, Department of Sharira Rachana, JSS Ayurveda Medical College, Mysuru. It's my pleasure to welcome you all for the Rachanavadhana 2020 Exam Orientation Program on behalf of Department of Sharira Rachana, JSS Ayurveda Medical College, Mysuru. Today is the 5th day of guest lecture series. For today's guest lecture, we have with us Dr. Jacinta Meena D'Souza ma'am, Vice Principal, Professor and HOD, Department of Sharira Rachana, Karnataka Ayurveda Medical College, Mangalore. I welcome you ma'am on behalf of Department of Sharira Rachana. So now I request Dr. Alka ma'am, Professor, Department of Sharira Rachana, JSS Ayurveda Medical College, Mysuru, to introduce the guest. Ma'am, please.
Good afternoon, everybody. It's my immense pleasure to introduce Dr. Jacinta Meena D'Souza. She's my very much good friend, very good human being, and it's literally, I feel very glad to introduce my friend, that is Dr. Jacinta ma'am. Ma'am did her BMS from Government Ayurveda College, Mysuru. MD, she did her MD from SDM College of Ayurveda, Udupi. Ma'am has 13 years of vast teaching experience. She has participated and presented so many papers in various seminars. Now, ma'am is working as Vice Principal, Professor and HOD in Karnataka Ayurveda Medical College, Mangalore. Now, ma'am is going to speak about the topic digestive system and its importance in the exam, because this is the exam orientation program. So ma'am will give her, that means very good guidance, and whatever her experiences are there, that all the things she will share with you. So next, over to ma'am. Thank you, ma'am.
Yeah. Good afternoon, everyone. Respected my friend, Dr. Alka ma'am, and Dr. Chaitra S., Assistant of Rachana Department, and my dear students. So I do not, without delaying, I want to start directly to the topic. So let us begin with the topic. So today is my topic. Can you hear me?
Yes, ma'am. We can hear
Yes,
you.
no?
Please proceed.
Okay. Yeah. So today is my topic, digestive system. Yes. Keep in mute, all please. So just listen what I am saying. See, the topic which is given is it is important system both in theory paper as well as in a practical. So both the purpose, I'm going to share my feelings, and as ma'am said, whatever experience I'm having, I'm going to share with you how to write and the probable questions from the each individual organs.
ಬಾತ್ರೂಮ್ ಜಾಕೆಟ್ ಬುಕ್ ಮಾಡಿ
Yes. So first, digestive system.
Ma'am, please unmute.
Now?
Ma'am.
Now okay, no?
Now we can hear, ma'am.
Yeah, so digestive system. Now, this is very, very important system in our body, and for student, it is very, very important in practical as well as a theory. So you cannot skip this system, and even single organ also you cannot miss. So today what I am going to say, just listen. So first, how you have to study for the exam point of view. First, you should know the parts, means what are the, enumerate the organs of digestive system. Now, what is it? So I have given the answer along with that. It is the oral organ, gastrointestine or alimentary tract, or are the oral cavity, pharynx, esophagus, stomach, small intestine, large intestine, and anus. And what are these? See, liver, pancreas, and gallbladder, they are also solid organs of the digestive system. They are glands. Okay, so they also comes under digestive system. So this is why I have given there. And what is the probable question in this? So in general, while speaking about digestive system, in general, while speaking about digestive system, this is a question which comes for 15 marks. That is the enumerate the organs of digestive system or gastrointestinal tract or alimentary tract. Explain here what you have to write for the 15 marks. That is the explain the location of the organs, dimensions, and the parts. That is very, very important. And the anatomical relations, or 2 or 3 relations, if you write, it is sufficient. No need to hit your head. And blood supply and functional importance of any one organ. Okay, so if it comes, so usually they won't ask you to explain all the organs. Okay, they will say enumerate, and they will ask 1 or 2 organs sometime. Okay, so be ready with the diagram and the explanation. So this carries 15 marks. As now for the recent question paper, it is according to recent question paper. I have said there's a 15 marks. Okay, this carries. Okay, next. Yeah, see, this is the figure. So because of the pandemic case, you were sitting at home, so you might have forgotten, or I do not know whether you have started. So that is the reason some of the places, some of the slides I have shown, so that you can understand, you can recollect the things. Okay, so here complete digestive system figure I have highlighted. I'm not going to explain in detail because it is an exam orientation. So that is why you can start from the mouth. So whatever I have said in the previous slide, the figure is given here. That's all. Okay. Next. Yeah. So starts from the oral cavity now. Now this is the first one. We have to start with the oral cavity. And I have highlighted the figure. So these are the parts. I said you must know parts of the oral cavity in the beginning. Okay, in the beginning you should know what are the parts which are present in the oral cavity. Okay, so with this figure I have highlighted, so upper lip, lower lip, frenulum by folding the tongue, then even the tongue, then soft palate, where is the soft palate, where is the hard palate, all these, everything, these forms the parts of the oral cavity. Okay. Next, see here the probable questions from the oral cavity according to the marks I have given. So first point, when you put together all this together, then it will becomes the 15 marks answers. Okay, so total, that is the definition first. What is oral cavity? There is an anatomical definition you have to give. Then the parts of the oral cavity or the anatomy of the oral cavity. Again, if it comes for 2 marks, you have to write, no need to explain here, I have given already. Okay, next you must know diagram. Then the one, that is a sense organ, which is a very, very important. It may come for 5 marks and it may come for 15 marks. Okay. So when it is a 5 marks, then you have to write the parts again. Okay. Then papilla of the lungs, then the nerve and the blood supply of the tongue. Okay. So this you have to write in a brief, point wise you have to write it. Okay. While you're writing 5 marks, then no need to write big stories. Okay. And you have to write figure compulsory. For 5 marks and 15 marks, diagram must be there, because sometimes when you are not writing, you don't have in a sufficient time, then your figure highlights what you know or your knowledge about that content. Okay. Then papilla of the tongues may come for 2 marks. The nerve supply of the tongue, 2 marks. Then dental formula, because it is in an oral cavity, so that also may come for 2 marks. Okay. That's a dental formula in osteology book. It is there. So this much. This forms the oral cavity. Okay. Next topic is the pharynx. So oral cavity finished. Then coming to the pharynx, I have given the figure. So how the pharynx is, and it is continued from where? After the oral cavity, you are going to pharynx. So subdivision for 2 marks, I have given their side. You can see the slides. So probable questions from the pharynx. So this is the part of the digestive system of pharynx. So 2 marks, that is a subdivision. So that is a nasopharynx, oropharynx, and the laryngopharynx. So it is well organized figure. So you can see here where and all it comes. Okay, where the soft palate, where the epiglottis, where the cricoid cartilage, up to there, isn't it? So next, blood supply of the pharynx, that is also 2 marks. Okay, again you have to find out, you have to write the diagram you should know. So you can use this diagram. This is about the pharynx. Okay, next. See, these are the parts of the pharynx. It is given with the help of the figure from where it starts. Okay, nasopharynx, which is in a pink color, you can see here, and parts of this nasopharynx, which is highlighted in the figure. Okay, I'm not going to read it, because if I read it, definitely it will take more than 12 hours. So that is why it's a complete system I have to finish. So just go through the slides and note down. Okay, this. Okay, next you can see it is in a yellowish color, some oropharynx. Okay, so these parts are given different parts. Then the laryngopharynx, that's a bluish in color. You can see here bluish in color, that is the laryngeal part. Okay, so this forms the parts of the that is the pharynx. Okay, next. See, once again, when coronal section is taken, so openings of the pharynx, that is the auditory tube, how it opens by the sides. Okay, you can see. Then the 2 posterior nares, larynx and esophagus, how they are connected to each other with the pharynx. This is a figure, shows you how it is connected. If you see it properly, then you can understand how it is sectioned. Okay, then also it contains tonsils. This may be for the 2 marks. Okay, again the pharyngeal tonsils, then the palatine tonsils, lingual tonsils, and the tubal tonsils. These are the tonsils. This pharynx contains these following tonsils, which may come for 2 marks again. Okay, so while it is a 2 marks, just mention the name and no need to write the figure. Suppose if you do not know anything and you know the figure, you can remember, then don't skip. At least you put your figure or write or draw figure, so that you may get out of 2, at least 1 mark you may get. So even 1 mark is very, very important. All of you know this time Viva is not considered, Viva marks are. So it is a purely theory, and it is totally depend on your effort, not on staff, or because while we are doing practical, we may give marks. So, but here this time there is no chance. So it is only your effort. That is why you need to do hard work, and with the calculation you have to study to score 50 marks. Okay, next. esophagus, and here the physiological part not necessary. So just to show you, sorry. Yeah, just to show you the figure, because I told you already, because of the pandemic disease and because of the inconvenience. Okay, so that is why I have highlighted the figure so that you can understand. Okay, so pharynx with the upper esophageal sphincters are very, very important. Okay, lower esophageal sphincters. There are how many sphincters you have to see. So that is the esophageal upper and the lower. So maybe it is maybe 2 marks. Okay, again. Then here, see, when esophagus comes for as a 5 marks, then you have to write the length of the location. I have given there, written there. Constriction, this is very, very important. Okay, this is one of the important question even for the 5 marks. Okay, then blood supply, nerve supply. So total it carries 5 marks. To the point you have to write. In anatomy, don't write stories. Okay, if you write it in order, step by step, to the point, then that is enough. Okay, even if you elaborate many things here, then it will become the 15 marks, because 15 marks, then you have to write the cervical part of the esophagus as it is in the figure. You can see in the figure, there's a thoracic part of the esophagus and the abdominal part of the esophagus. So 3 parts you have to divide and you have to write. Okay, if it is a 15 marks. And very, very important, that is a surface anatomy of esophagus. That is a 5 marks. So this is very, very important in the, as I told earlier, that is, it is very, very important even for the practical also. Okay, surface anatomy they may give, even in the theory paper also they may give surface anatomy of esophagus. You should be ready for that with the 5 marks. Okay, so for the 15 marks you have to write each part separately. Okay, with this figure you can see here. Okay, next. See here, this is one of the very, very important in Viva also, even in the theory also, that is the constrictions. So I have given with a figure that is from the incisor teeth, from the incisor teeth, how many centimeter it is. See, cervical esophagus region, okay, where the cricoid cartilage is there. Next, aorta, that is the overarches, okay, that's the 18 to 22 centimeter thoracic esophagus is. So cervical is 3 to 5 centimeter. You can see there that measurement is very, very important. Okay, so this is the constrictions. Then the abdominal esophagus, you can see. So that means there are 3 constrictions in the esophagus. Okay, then the muscles of the esophagus is also important, where it shows the peristalsis movement, where the circular muscles helps for the peristalsis movement, circular. Even though it is having also longitudinal muscle, and that is also helping in the peristalsis. Okay, they may ask muscles of the esophagus. So that is a circular and also the longitudinal. They may ask in a Viva also, that is maybe they may ask. So you should know, that is a basic knowledge. Okay, so this is about the total length is the 39 to 14 centimeter. Okay, so next. Yeah, so next topic is, that is the stomach. And stomach is very, very important. I have highlighted here the figure of the stomach to show you the parts here. Okay, you can see there cardial opening and the duodenum. It opens into a duodenum. You should know from where it starts and where it ends. Stomach. Then the shape of the stomach also very, very important. Okay. So then the probable questions are there. I will just read out. See, this is the layers of the stomach. In the figure you can see longitudinal layer, circular layer, oblique layer. You can see with the figure, with the help of and the parts also you can see fundus, body. Okay, then the pylorus part, 3 parts. In the figure it is given. And see the important structure, there is a rugae of the mucosa. When you cut, that is the internal part of the stomach, when you open, you can see the rugae, isn't it? So even in the pyloric part, sometimes they may ask only pyloric part. Then you start from the pyloric antrum, pyloric canal, and pyloric sphincter, or the valve. So that gives you 2 marks. Okay. Then what is lesser curvature? What is greater curvature? Sometimes they may ask in the Viva. Okay. So you should know parts, muscles, layers, and the shape, and also opening and the curvature of the stomach and the pyloric antrum. So when you combine these 2 marks, then it will become 5 marks answer. Okay. So next, see here I have given probable questions from the stomach. Okay. See, explain the internal and the external feature of the stomach with a neat label diagram. That is the 15 marks. I told you already. So how you have to write each one. So each you have to divide 2 marks, then combine it. Okay. Then position and the location 2 marks. Parts of the stomach 2 marks. Sphincter of the stomach 2 marks. Layers of the stomach already in the figure I have shown now. Internal and the external, that is layers means from the internal to external, that is 2 marks. Muscles of the stomach sometimes 2 or 5 marks. Okay, you should know differentiator when you are writing 2 marks. Brief names compulsory, then if brief what is made of anatomical structure. When it is given 5 marks, then you can add some of the physiological aspect also little bit. Okay, then muscles. Then blood supply of the stomach, very very important. Why I am saying blood supply is each organ. See, sometimes in the practical exam they will keep the from the oral cavity to, maybe they maybe keep model, or they may keep organs or the specimens, or they may keep some charts or whatever, x-rays, whatever it is. Then so they will ask spotting, we will say. Okay, you should know the names of the each part of the organ. Okay, sometimes they may give in a rotation wise. Okay, 2 marks carries. So that time you should be prepared not only for the practical time, even for the theory time. At least you can write something. So otherwise you have to skip that question. So when you are reading for the 2 marks, at least while you're reading along with the 5 marks and the 15 marks, it will be easy to remember in your exam, as well as in the, you can attend your viva boldly, I can say. Okay, then blood supply of the stomach. So sometimes they will keep all the organs, we have to write 10 specimens, you know. So they will write in randomly, like means they will write on a board that write the blood supply of all the organs, all the specimens given. Then you need to study from the digestive system, compulsory blood supply, nervous supply, lymphatic supply. Remember, okay, this is compulsory, you have to study. Why you have to keep your viva? You have to study during your theory, so that you can write whenever you do not know anything, you can write some. Hello, ma'am. ಹೇಳ್ತಾ ಇಲ್ವಾ? ಓಕೆ ಓಕೆ, ಒಂದು ನಿಮಿಷ. Okay, see, this is the one of the important stomach bed. Okay, so this is the one of the very very important. They will ask in viva, they will ask in theory paper, and even you have to write. So you should be ready. So this is the written, this thing is given. What are the things? I'm not going to explain in detail. Again, I am saying I'm very sad that I cannot explain you, because I have to finish, complete this thing. So you can go through these. These are the structures. Bed, you know, you are sleeping on the bed. So in the same way, stomach is sleeping on the some structures. Okay, that even it forms the relation also. So each organ relations you have to study 1 or 2 relations. If you remember, it is more than enough. If you are capable, able, then study all the relations. Okay, so this is the stomach bed, one of the important question. for the theory as well as the viva time also. Yeah, see, I have given the, yeah. Next, small intestine. Moving to after the stomach, you know, that is the small intestine. Yeah, after the stomach comes organ is the small intestine. So when the even this is also start with the 2 marks, okay, then go for 5 marks while you're studying, pattern you keep, okay, then everything kept together and what is remaining underlined in your textbook and add it for the 15 marks. Understood now? So when they are asking each individual, small intestine means you should do the parts. See here given after the stomach, duodenum, jejunum, ileum. These 3 parts forming the small intestine, and that is you have to write anatomy of the small intestine. See, these are the probable questions from the small intestine. Length and the part of the small intestine. That's the 2 marks. Difference between the anatomical structure of small intestine, because you have to differentiate the structures. Though they are the same, in some region they are minimized structures, some they are predominant. You should know this, okay? So while you are going through, once you have to go through complete, then you have to underline which is important. You have to take, okay? So difference between anatomical structures of a small intestine, and that is a 2 to 5 marks again. Then blood supply is very, very important for the small intestine, okay? So duodenum, what is the blood supply? Jejunum, what is the blood supply? Ileum, what is the blood supply? Okay, so that is a 2 to 2 marks. Separately they may give sometime. Even in the viva also it is important, or practical classes, even during the specimen keeping, spotting I say, so that time also you should know the blood supply, okay? Then Peyer's patches, this is the one of the important thing. Sometimes it will come in question paper. I have gone through question papers 10 to 12 years. I have taken all the questions from those question paper and I have highlighted here. So these questions are very, very important. So please, dear students, go through this, don't ignore, okay? Peyer's patches, that's the 2 marks. Now you should know Peyer's patches, where it is present, whether it is present in a small intestine or whether it is present in a large intestine, okay? So first you have to see Peyer's patches, which is in a small intestine, especially it is well marked in the ileum region. And what is its function? What is it is related with? That is the immune system. So for the 2 marks, you have to write like that, okay? So main thing you have to write, you should know the location where it is present and what it is and what it contains, the B cells, T cells, so these things, histological, some parts, okay? So you have to prepare, okay, what you have to write. It may come for 5 marks sometimes, if we do not know, okay? Then you should know little bit about this, okay? Next. Yeah, see, for your convenience, I have given some of the explanation which is very much needed, okay? Parts of the small intestine. Then which is the shortest one? In viva time they will ask, which is the shortest? See, second point is that duodenum is the shortest, most fixed portion, okay? So, see, which in viva time they will ask, fixed portion of the small intestine, that is the fixed portion of the small intestine is the, that is the duodenum, and the rest is a mobile and lie free in the peritoneal cavity. See, these are the important points I have given to you, so go through it please. Then the small intestine is suspended from the posterior abdominal wall by a double layered fold of peritoneum called mesentery. Now they may ask, what is mesentery, for 2 marks or 5 marks? So then later I will tell you. Just these are things which are very, very important in the small intestine, okay? Yeah, so one sec. Yeah, next, the small intestine extends from where to where? That is the pylorus to the ileocecal junction, okay? You should know from pylorus part to the ileus opening, then to the ileocecal junction, It is about 6 meters long. This is very, very important. Sometimes they will ask in viva. Length of the each individual digestive system is very, very important. First only I told dimensions. There's a 6 meter long and width, that is a 2.5 to 3. Then the surface area of the human small intestinal mucosa averages 30 square meter. This is very, very important for your knowledge purpose and for the exam purpose also. Okay, next. Yeah. Yeah, see, this is the structure of the small intestine. I'm not going to read this. You can go through it. I have given. Okay, so this is already in brief. I have explained. This is here adult female and adult male difference of the structures. Okay, that is how much feet it is. It is given. Okay, I'm not going to say. Then this is very, very important. So sometimes they may ask wall of small intestine. How many coats are there? Okay, in small intestine, in viva also, in theory also for 2 marks, serosal coat, muscular coat, submucosal coat, mucosa coat. Okay, these are the following layers of the small intestine for 2 marks. When they ask for 5 marks, then you have to explain in detail. I have given already. For 5 marks also it is given. Okay, 2 marks also given, 5 marks also given. Okay, so I'm not going to explain. Please go through it later. Okay, so muscularis, submucosa, mucosa consists of a layer of epithelium. All these are, it is given. Okay, go through it, please. Yeah. Next, histology of the small intestine. See, each one they may ask 2 marks, like a plicae, villi, lacteals, intestinal glands. Okay, so all these they may ask in viva also. These are the structures, histological structures you find in small intestine. Okay, while you are writing the difference between the large intestine and the small intestine, that is a very, very important question. So then you have to go through these structures. What all the villi are very, very important for the purpose of digestion. Okay, so finger-like projections of the mucosa they are. So they may give for 2 marks, or they may give for sometimes completely histology. Okay, you should go through it. Okay, next. See, next that is the, so I have individual type. Now it is overall. I told what you have to write when it is given small intestine. Okay, so whatever said before for the 15 marks, you have to combine all. Then individually you have to. So diagram must for the 15 marks. Okay, even for the 2 marks also, when you do not know, you know diagram, then you first draw the diagram, then write in a brief. Okay. Next, so here see, when you say about duodenum, first you have to highlight parts of the duodenum. First part, second part, third part, fourth part. There are 4 parts are there. You should know basic things and the shape of the duodenum. That also basic things. They may ask in viva as well as in a theory. Digestive. Once again, I will stress. Digestive system is very, very important system, both in practical as well as in a theory. You cannot escape or you cannot skip this topic. Okay. So first part and the position also given. See, from first part, what is the position? Like which vertebrae, median plane, you can related there. Okay. Then the flexure. What is the meaning of they may give superior duodenal flexure. They may ask in viva. So it is the attachment of the, so where it bends, no, it will come in a relation, okay, with the peritoneum. So it forms the flexure, okay, superior duodenal flexure, inferior duodenal. See where the turn, where it bends, where it flexion shows flexion, okay. So this is the one. Next, so this is the, see, internal, how the duodenal part is internally. They may ask the interior of the duodenum. Okay, or the first part of the duodenum, or the second part of the duodenum, or the third part of the duodenum, according to the marks you have to write. 2 marks or the 5 marks. See the folds, circular folds, you can see descending duodenum. Then papilla, where it opens, that is in the second duodenum. part of the second duodenum. That also you have to observe. So you have to write, okay? So they may give, so we do not know which question they may give 2 marks or 5 marks or 15 marks, okay? Next. See, probable questions already have given. First, the parts of the duodenum. Then diagram is 2 marks. Anatomical relations 2 marks. Parts of the duodenum 2 marks. The second part of the duodenum 5 marks. Third part of the duodenum 5 marks. First part of the duodenum 5 marks. Okay. When these all combine together, it will form the 15 marks. Blood supply, nerve supply also 2 marks. Then the surface marking. Most of the time, sometimes in theory paper, they may ask the surface marking of the duodenum. Okay. It may be 2 marks sometime, or it may be, in brief, 2 marks means you should know where the points are located. Okay. Next. See, jejunum, second one, that is the 2 marks when it is given a jejunum. So you know already small, see, one thing I will tell you, how you can escape is when you do not know anything, then you should know the small intestine parts already have told what the structures anatomical. You have to write the same structures here, okay? And you have to write the blood supply. Okay, jejunum blood supply. That is 2. So you can see there. So I have given the figure. See the longer vasa recta. So this also sometimes vasa recta may be 2 marks. They will ask. You should know what is it. The vasa recta, how they are forming the windows. Okay. Then you can see short vasa recta, how they are forming, how they are supplying to the jejunum. Okay. So when you study small intestine in general, that can be when you want to write for individual parts, then you can bring from there also, okay, to the special features of the jejunum, along with those things, anatomical structures you can write. Okay, next. Yeah, see, anatomy, length, location, structural difference between jejunum and the ileum. This is important. So jejunum and the ileum, 5 marks question it is. Okay. Difference, anatomy, length, location, structural difference. Okay. So which comes the jejunum and the ileum. So which makes 5 marks. Then the layers of the small intestine, already I explained for the 5 marks. Okay. And a figure also given here, how this mesentery is attached to, how it is supplied, and the solitary lymphoid nodules, you can see the inner structure, circular folds, that is the valves of Kerkring. Okay, they may give sometimes 2 marks. Okay, so when you write valves of Kerkring, it is given, you write it is a circular folds which are present in the, that's the jejunum. Okay, so this is the one. Next. Okay, jejunum and ileum, that is this. I have given how they are located, which side, which quadrant. Okay, you should know for basic. This is for your knowledge. Which side? Sometimes in Viva they will ask which side ileum is present, which side jejunum. So this is the figure showing, okay, where it is present and where it is present, and the length, everything it is given. I'm not going to explain. You can go through it later. Now, so that completes the small intestine. Okay, that completes it. And anatomical aspect of each organ, 1 or 2 you must know now. This is now. So because earlier we used to skip anatomical or clinical aspect, remember. Sometimes it may come for 2 marks. Write clinical aspect. At least you should be capable to write at least 2 clinical aspect with the one brief line. Okay. Next, see, large intestine. We will start with the large intestine. While you are studying large intestine, these are the probable questions. Parts of the large intestine in order, 2 marks. Blood supply of large intestine, 2 marks. Difference between structure of small intestine and large. See, not only this, even the small intestine also and the large. This is also one question, that is the 5 marks. Now you know what you have to write the difference. So you have to make a chart. How you are writing now difference? Don't write like a long story. Okay, you have to make a chart or the column. Okay, small intestine, large intestine. Okay, which is first you write the structures, then present, absent, length. Okay, understood how much it is. So you have to make a column so that you can save your timings as well as you can impress the examiner. Okay, understood. Okay, so in this way you have to go. Okay, so that you can impress. Okay, next, blood supply compulsory. You have to see for the specimen keeping, spotting. Even in the theory paper also they will ask. Okay, nervous supply, that is 2 marks. Then these are the structures. This is very, very important. How to differentiate large intestine from the small intestine. Like you can see the tinea coli. They may ask separately. So explanation is given. I'm not going deep. What is tinea coli? For 2 marks. What is saculations? 2 marks. Then the appendices epiploica, 2 marks. Okay, 2 marks. Okay, so when you combine everything, then it will become the again 5 marks. Okay, next. See here, figure is given. Okay, so the large intestine figure, that is the ascending colon, cecum, ascending colon, then the transverse colon, then the descending colon, sigmoid colon, and the rectum, even appendix, ileocecal junction, appendix also. Okay, so this is a figure just to fresh up I have given. Okay, so anatomy of the large intestine, you can see here. See the right hepatic flexure, where it is attached. Right splenic, left splenic flexure. You know, liver is on the right side, spleen is on the left side. Okay, so then next. See, this is the cecum. Probable question, cecum. So just they will give word cecum, then 5 marks. Then you have to write the diagram. Then you have to write the pouch it is. Then where it is opens, where it is continuous. Okay, the diagram is must. Definition, what is cecum, location, blood supply, nervous supply, lymphatics, and the circular folds, which is mucosal folds which are present. Okay, that you have to write. Okay, so that carries the 5 marks. Cecum. Then the this is very, very interesting. You know, the peritoneal layers are there in the abdomen. They are attached to this large intestine. When it is attached to the small intestine, it is called a mesentery. Okay. When it is attached to the large intestine, it is called a mesocolon, because ascending colon, transverse colon, descending colon, you are saying. So mesentery, 2 marks. They may ask what it is. So then blood supply of the mesentery. Okay, this is the blood supply of the mesentery, 2 marks. Then superior mesenteric artery. It has come many times in question paper. That's why I have given this. Okay, 2 marks question it is. Okay, many times. So you know superior mesenteric artery. While you are reading superior mesenteric artery, you should go for the inferior mesenteric artery also. Okay, so 2 marks. So then combine it. So this is how you have to make it easy how to study these parts. Okay, next here. Again, see, I have given in the first slide of the large intestine what is tinea coli. So you can see here. Okay, you have to see this figure. One thing I would like to tell you here. Always I will say to my student, don't study blindly while you are studying any organs or the specimens or the whatever may be. You have to open your book and you have to see the figure. Okay, then you have to see the figure and you have to study. Then only you can understand what it is. Don't mug up the things. Okay, so don't mug up the things. When you see the figure, then you study, then you will understand to identify also and to write something. It will remain in your brain or mind. Okay, what you are seeing, it is printed in your computer like brain. Okay, see, you can see here. This is a tinea coli. So, okay, you can see here, tinea coli. What is the epiploic appendages? See, okay. So, you can see here what is. Then host means the circulations. You can see here. Okay. So, these all separate. Sometimes it will come for, okay. Yeah, it will come for, yeah, come for, it will come for 2 marks or 5 marks. According to that, you go. Yeah. So next, after the cecum, there is an appendix, which is an important topic. So appendix may come for, there's a position of the appendix. This is very, very important. Sometimes they may ask for 2 marks or 5 marks. And the figure shows you what all the position is there in appendix. Okay, you have to write these positions. Sometimes if they ask for 5 marks, then you draw the figure. Even for the 2 marks, if you write this figure and give brief 1 line or 2 line, then more than sufficient for 5 marks also it is. So you can see there. Okay, then arterial supply to the appendix. That is also for the 2 marks. Okay, so this is also the important one. Next, rectum. Okay, next is the rectum. So where rectum comes after the sigmoid colon. Okay, after the sigmoid colon, most of the time they have asked this question: length, anatomical structure. There's a 2 or the 5 marks they have asked many times. Then the arterial supply and the nerve supply they have asked. There's a 2 marks. Okay, and so this is the probable question in the rectum. Okay, you should know the rectum from where it starts and where it ends. Okay, so next figure you can see there. Yeah, see, this is the length, anatomical position. This is the anal canal, anatomy of the anal canal, probable questions. Length, anatomical position, that is a 2 marks. Then the interior of the anal canal, 5 marks. Figure itself, next figure is there, you can see there. You can see there rectal ampulla, the anal canal. Then the anatomical structures and the anal sphincters, 5 marks question. You should know internal anal sphincter, external anal sphincter. The simple figure you have to draw. Okay, then the anatomical relations, 2 marks. Blood supply, nerve supply, lymphatics, 2 marks. And the clinical importance. This is very much important here in this case. Rectum, then the anal canal. Okay, so next. See, here you can see sigmoid colon. Then you can see the rectum folds. Can you see transverse rectum, superior, middle, and the inferior? They may ask for 2 marks. Okay, then the anorectal line. That is the, so till there it is rectum. After that, anorectal line, you can see that. Okay, anorectal line. So you have, and pectinate line. Sometimes they may ask in viva, what is pectinate? This is nothing but you can see their mucosal folds are the columns they are forming there. Okay, next. So levator ani muscles. This is the one of the 2 marks I have seen in the question paper. That's why I have given this question. Okay, levator ani muscle. See here in the figure you can see iliococcygeus, fibococcygeus, and even sometimes in vivo also, most of the time I have a habit of asking name the levator ani muscles. Okay, so for, see, this is for the theory also. Column of Moragagni. What is this column of? This is a mucosal fold. It's given here. See, you can see in the figure. See here, you can see there. There's a column of Moragagni. See the figure. That's why I am showing the highlighting figure is, I want you to study in this same way. You have to open your book. Okay, open your book. All are having mobile. Open, go to Google, and what you are studying, just type it, and you will get the beautiful pictures. With the help of the picture you study, then you will come to know for how much you have to write for the 2 marks, how much you have to write the 5 marks. Okay, then 15 marks in detail you have to write. Okay, and okay, next. So column of Moragagni, already I told you, is a mucosal fold. You should know that where it is present. Okay, which part of the organ it is present, that you have to write. Okay. So next we shall move on the glands. So that completes the digestive system from the oral cavity to anus. Okay, so now 3 organs are there, that the glands are there. So what are the probable questions may come from this? That is the yeah, so this is the liver. See, explain liver in detail with a neat label diagram, 15 marks. 100%. This is for viva, this is for the practical, and this is for the theory. Okay, these questions, whatever it is given. Compulsory question, many times repeated in question paper. Okay, with the help of the figure, you have to study. Explain liver in detail. Ligaments of the liver, 2 marks. Lobes of the liver, 2 marks. Porta hepatis. What is porta hepatis? That's 2 marks. Bare area of the liver, 2 marks. Blood supply of the liver, 2 marks. Clinical anatomy of the liver, 2 marks. Surface marking is very, very important. In practical exam time, some of the important organs, the surface marking are given, like stomach, liver, spleen, pancreas, esophagus, okay? Then sometimes duodenum, okay? So then some which is not related to me, which comes in within my limit, I will say today, okay? So surface marking of the liver. Next, see here to fresh up, I have given this. What is porta hepatis? See where it comes. Okay, then lobes. Okay, lobes of the liver you should know. Bare area of the liver, ligaments. Okay, all these things. Okay. Okay. Next is the gallbladder. This is also one of the part of the digestive system. Gallbladder. The probable question: explain the gallbladder with the neat label diagram that comes for 5 marks. And you have to write this figure. You have to label it, okay? Then you have to, you have to label it, okay? Then you have to write the explanation of the fundus, where it is present, what is the anatomical structure, body, neck, okay? Then parts of the gallbladder. When you study this 2 marks, when you divide, it will become 5 marks. So parts of the gallbladder, blood supply of the, then the common bile duct, one of the 2 marks question I have seen in the question paper, okay? Common bile duct, how it is formed, okay? So this is the one. Next. Okay, see, next is the pancreas. Now pancreas, this is also 5 marks question. Sometimes they'll give write only pancreas. Then you have to explain parts, okay, divisions. See what all comes. Diagram you have to write. Then parts means it is having 2 parts, you know, exo and the endocrine part. Then the regions or the divisions, okay, divisions means neck, body, tail, head, proper, and the uncinate. With the help of the figure I have shown you here, okay. Then the artery, nervous supply, lymphatic supply, and the clinical anatomy. You should know clinical anatomy of the pancreas, okay. Then the neat diagram structure of endocrine part. Sometimes they may ask 2 or the 5 marks, endocrine part of the pancreas. You should be ready for that. What is it? Endocrine part. Which forms the endocrine part, okay. Next, surface marking, as I said earlier, even for the practical exam also, okay, even for the practical exam also, even for the theory exam also. Then the applied aspect, again, pancreas also, applied aspect. Then the pancreatic duct, this is very, very important. Maybe in the next figure I have given to see the pancreatic duct, okay. Okay. Yeah, see here you can see this figure, how the pancreatic duct opens, ampulla of water. Sometimes they may ask 2 marks. Why I am showing figure is you should know where it comes at least while you are writing. Blindly don't write. So when you are writing where it is, at least they will come to know that you have the knowledge of basic anatomy of, okay. So understood, no? Okay. So then see here how it is located, gallbladder or common hepatic duct, and the pancreas, where it sits, how it opens. See the figure. And pancreatic duct, I said just now, 2 marks they may ask. See that figure. You just draw this figure. You may get half marks. If you don't write anything, you know that there is a duct which opens into second part of the duo. Yeah, don't leave. Just draw a diagram at least, so that this time your effort. Remember, again and again I'm saying your effort is needed for the theory. Okay, you cannot gain or borrow marks from the viva. So you should be thorough, and you should go with a calculated manner. Okay, how to write, how to study system wise. Okay, next. See here once again. Okay, pancreas, duodenal ampulla, how it is opening. So a clean picture I have given. I'm not going to explain. So sorry, dear students. Okay. So this is also one some pictures I have put. Okay. Yeah. See, this is about the artery, splenic artery, maybe 2 marks. Then pancreatic hormones. What are the hormones? It may be viva question. Okay. Insulin and glucagon. See, these are then pancreatic islets. You can see pancreas 2 marks question, it may be alpha cell, beta cell, exocrine, SCNS part. Okay, so you should know that these all, what are these structures anatomically, how they supply, blood supply. Okay, then see, so that completes the pancreas, liver, and the gallbladder. Okay, these parts. Okay, then related with the digestive system, some of the things are there, like vagus nerve. It is a parasympathetic nerve. This has come, I think, more than 6, 7, 8 times in a question paper. That's why I have written here vagus nerve, because this is a nerve. It is a parasympathetic nerve which supplies to all these abdominal organs, digestive system. Okay, so most that may come for 5 marks. It has come, okay, many times. That's why I have given. Then omentum. What is omentum? Already I told there is a peritoneum in the abdomen region which is connected with the digestive system. You should know the definition of the peritoneum. What is it actually and where it is attached. Okay, that also you should know. Okay, so the peritoneum here, the omentum means when it is attached to the stomach, it is called omentum. So it may come for 5 marks. How it is attached to the greater cervature and to the lesser curvature. When it is attached to the greater cervature, greater omentum. When it is attached to the lesser omentum, lesser curvature. That for the 5 marks. Again, epiploic foramen, it has come more than 8 times in question paper. Epiploic foramen. What is it? In the figure I have given. So when it is given epiploic foramen, you have to write introduction. What is it? Definition, location, boundaries, and applied aspect. Okay, epiploic. It may come for 5 marks. And you can see here the arrow mark shows you the epiploic foramen with the right free margin. See, this is the mesentery under this. Okay, epiploic foramen. Then the lesser sac. When you remove this, okay, when you remove this part, what I am showing, you will get the lesser sac. Okay, lesser sac from the upper to lower part. Okay, dividing. Okay, so next, see, position of the lesser sac. Can you see there when you are removing sac in the peritoneal cavity? That is also for the 5 marks. Okay, so this is the greater omentum and the lesser omentum. Lesser attached to the stomach to the liver, and greater covers the small intestine like an apron. Understand? Okay, so next. So this is about the vagus nerve. I told already it is a vagus nerve, from where it starts and its branches, how it supplies to the complete digestive system. See there. This is the figure. Okay, very, very important. For any like digestive system organs, the blood supply, nervous supply is parasympathetic, then you have to write vagus nerve. When you study parasympathetic, what is parasympathetic? That also you should know. Sometimes they may ask for 2 months. I think 6, 7 times they are asked parasympathetic. Then you should know what is parasympathetic. Stimulation giving. Okay, so then what is sympathetic? That also you should know. Okay, inhibition. Okay, so like that you should know. Okay, 2 marks. Then vagus nerve. So this is the beautiful figure showing the vagus nerve. Okay, next, see, this is the cranial nerve, one of the 10th nerve, vagus nerve. It is a critical nerve for the supplying parasympathetic information to the visceral organs of the respiratory, digestive, and the urinary systems. It's important in the control of heart rate, bronchoconstriction, and digestive process. Why I picked up here is because my topic is digestive system, and vagus nerve is the very, very important nerves. You know that where the sympathetic, it is the according to the organs. They are like appendix, celiac, like that. Nerve flexes are okay. Sympathetic, they are the different. Okay, celiac flexus. Hypogastric flexus, like that, different. Okay, but here this is the vagus is the parasympathetic. Okay, so this complete with so what I wanted to say is, one is, so this is a complete digestive system. Some of the things might be missed here, so I will ask if anything is missed. I will ask madam to give clear picture to your students. And one more thing is, don't skip this digestive system. Okay, any part of the digestive system. This is for your future knowledge, because you know surgical aspect. Now Ayurvedic students also can do surgery. So while you are doing surgery, then you should know the basic things of the anatomical structure. So you shouldn't wait for go to Shalya and do surgery, but you should know from the first year itself if you wanted to become a great scholar or great surgeon. Okay, so you have to go in a calculated mind, then you have to go according to the marks and go to the question papers, some 12 years question papers, so you will get an idea. Okay, wherever you won't understand or how much length you have to write, then you can contact your ma'am also. She's very good. And the thing is, and one more thing, exam point of view, I want to tell, see, when you do not know the question, but don't skip that question, put some figure, something you write so that you will get half for the 1 marks. Okay, so then one more thing, always try to write in an order. Don't write first, you know that first paper A and B, our topic is in the second paper, I think B part. This is the might be, yeah, yeah, it is the part B, second paper. It is there is where digestive system comes. Okay, so then all of you know Ayurveda 50, then the modern 50 in the first paper, then the second paper is purely modern it is, and especially it is a B, part B it is. So that is the carries 50 marks. One topic is the digestive system. Okay, so while you are writing, you have to see that how much out you can score, and you try to write in an order. Okay, always, and divide the timings. So for the 15 marks, how much times you can spend by writing. So then use some space when time is not enough. Okay, so for 5 marks, that you during the preparatory time only you have to do that. Preparatory exam is there, no? That time only try to attend all the questions and try to divide the timing, so that, because most of the students, why I'm saying here is most of the students are saying that time is not enough. They know everything, they do not, because they do not know the minimize the answers. They do not know minimize it. Okay, that is the reason. Go to the question papers and see that how the questions will come and how can you write and how can you can divide the timings. So with this, I conclude. This is an important topic, and also I'm grateful and thankful to JSS Medical College or institution and the management, and also respected principal, and also my dear beloved friend. She is also a good human being, as she explained you. So I'm from my bottom of heart, I thank her, and also for helping me out, and also to carry smoothly this session. I thank Dr. Chaitra S also, and for patient listening. My dear student, hope you have gained or benefited. I do not know how much you have benefited. As per my experience, what I come across with, I told today, and I will send this PPT to madam. So definitely she will give it to you, so that I have written the questions so that you can go through it, and the figures also. Thank you, one and all.
Thank you so much, ma'am, for such a wonderful session. So our students have few questions regarding your session. Can we take up, ma'am?
Yes.
Our first question, actually in syllabus point, salivary glands are not included. So whether they ask a question from salivary glands?
Yeah, actually they will ask many. I have seen the question paper. Even they have asked salivary glands, the types of salivary glands, how many salivary glands are there, and sometimes they have asked different individual salivary glands. They have asked. They should be ready for first names of the salivary glands. They should know, and then the function. Sometimes when they asked in 5 marks, they have to add even physiological, in brief, physiological aspect also. They should be ready with the salivary glands also. Yeah.
Okay, ma'am. So next question. So whether histology part of each organ is important or not?
The histology actually, it is a recent. Most of the times we will keep some of the slides for the practical exam. So when we are keeping slides in the practical exam, better to have knowledge of histology. Then only students can identify the histological. Why I am saying this is, this may be help them in a future, because when they become surgeons, because nowadays it is, Ayurveda, how much it is developing, and how much we can't imagine. While we were studying, it was not like that. Now it is progressive, because you cannot skip the things for the knowledge. I do not know whether they will ask in theory, because I have not seen so much, but only the pancreas and in spleen. Histological structures, so most of the times they have asked, okay, while I have seen the question paper, so most of the times they have asked, okay, and they have other topics they have not asked, but still, for the knowledge sake, better to go through it to become a competitive doctor in Ayurveda. Yes, ma'am.
Okay. Thank you so much, ma'am, for sharing your expertise with our students, and also you shared so many questions also, like you discussed so many questions with our students also. On behalf of Department of Sharira Rachana, we are very grateful to you, ma'am. Thank you so much, ma'am.
Thank you.
Thank you.
Thank you, ma'am. Welcome, ma'am. Thank you so much.
Thank you very much, ma'am. Thank you.
Love you.
Yeah.
Yes, ma'am. Hope it is benefited.
Okay.
Yeah, it is, ma'am.
It is benefited to our students, ma'am. Wonderful.
Yeah, I will send, madam. PPT I will send, so that they can answer the probable questions.
Okay, ma'am. Thank you, ma'am.
Thank you.
Yeah.
So tomorrow on 30th December 2020, we have Dr. Gururaj Jahagirdar sir, Associate Professor, Department of Sharira Rachana, SDM Institute of Ayurveda and Hospital, Bengaluru. Sir is going to speak on the topic Central Nervous System. So at the end, I thank all of you for your active participation in guest lecture on exam orientation program Rachanavadhana 2020. Thank you, one and all.
Thank you.